When you're a kid, if they're being whiny, you just dunk them under the water. When you're an adult, you dunk an adult under the water, suddenly you're getting sued. So kids usually don't have lawyers. That's a terrible joke. Breathe. Breathe, 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 breathe. Don't even worry about the breathing this time around, okay? Nope, she's worrying about the breathing. That's because I said it. Don't. If you at home want to play a fun game, every time I say, "Are you okay?" do a push-up. Leah, good to meet you today. Thanks for coming in. Leah is in today dealing with some kind of reoccurring neck stiffnesses and some which she's labeling as SI joint pain. So I'm going to let her kind of take us through exactly what it is that she's dealing with. So Leah, you care to share?
Yeah, so I've always had a bit of neck issues, like ever since probably early university I started to notice it, so a few years back.
Are you still in university now?
No.
No? Okay,
I graduated 3 years ago, so I guess it's more than a few years
Congratulations,
now.
sure, you know. But, okay, but.
Yeah, so I notice a lot of neck tension. Sometimes it turns into headaches, I feel like. Kind of like the top of my neck here.
Very high up.
Yeah, usually. I mean, also the sides. Pretty much everything, but this is the worst part, I would say.
Right at the base of the skull.
That's kind of when the headaches would happen, I think.
Okay.
But, so yeah, that's definitely something I would be concerned about a bit. And then more recently, like back in January, I had a flare-up of my low right back.
Okay, yeah.
I was just like doing laundry or like bending over for something and just felt it kind of flare up. And then for like a week or two, it was pretty bad.
So when you say, sorry to interrupt, but when you say you were doing laundry, just kind of like bending over, was like as you were bending over, you felt like or like something kind of went?
So it was as I stood up. It was like
as you're coming back up,
yeah.
like a tweak. But you felt like, oh, something moved that shouldn't have type deal? Or?
I think so, yeah. And it was different than the pain I had usually had or ever had before. Just kind of general
stiffness before. Okay.
Yeah, it was more of a sharp stabbing pain, I think.
Oh, fun. We love sharp and stabbing.
Yeah, okay. And it was nice.
That was in January.
Yes.
How has it been since, because we're filming this now in early July, so.
Yeah. So, that was the worst flare-up, but I've had smaller flare-ups.
Many flare-ups
yeah,
since,
so, I would say I noticed it sometimes on like longer walks or hikes, especially if the ground is uneven, if that makes sense.
No,
like,
that's very common actually.
Yeah.
You're laughing, it's like, that's so silly. No, it's common.
Yeah.
It's very common.
So there's that, and then I play volleyball and baseball, just like recreation, like adult league, nothing competitive, but I do notice it sometimes during those things, and also just like random getting in the car, or I think it's times where it's not even weight distribution, if that makes sense. So getting in the car or like lunging this way.
Got it.
You know what I mean?
When you're probably more reliant on that right side,
you
start to feel a little bit more maybe compressed or like stuck or whatever is going on in that region.
Yeah.
Okay. So you find it's really with the uneven distribution.
Yeah.
Interesting. Okay.
So I also ended up getting an X-ray on that area.
You mentioned that.
So I don't know if I should like read it.
That's up to if you're comfortable sharing.
Just what they determined, but
I always love hearing about medical reports for various X-ray findings. I might go on a tangent as to why, but I'm going to let Leah just share what she's got first.
Okay, so they said, I don't know if I'm...
Can I guess what they said?
Sure.
Mild osteoarthritic changes to the right SI joint, otherwise unremarkable.
Okay, so first of all, when I said SI joint, that is not what the X-ray said. That's what a physiotherapist said. So I was going to get into that, but you're similar because it did say minor L5S1 facet arthropy.
Okay, yeah, so that's essentially the exact same thing I just said, just at the one level above. Okay.
Oh, okay.
Yeah, okay.
So that's what the X-ray said, but then when I talked to my doctor about the X-ray, she was like, oh, like that's pretty minor, like it shouldn't really be causing you pain. I was like, okay, but I think it is, or something is. So then she sent me to a physiotherapist, and then the physiotherapist, based on my symptoms and everything and the type of pain, she said that she thought it was SI joint pain, which I kind of agree with based on what I've read, just the way it flares up, and sometimes it'll be like a couple hours, but then it kind of goes away, and it's just like more likely to flare up that week, but doesn't last long. You know what I mean? So, yeah.
So, I'm going to go on my tangent now. Lots to say about that. With the X-ray, your medical doctor did everything right. Okay, like that's having mild. I can't remember what the word was that they used. Arthropedic, whatever. Mild osteoarthritis is basically inevitable. Everybody gets it.
Yeah, that's what my physiotherapist said.
And more often than not, I'd say in like 95% of cases, completely benign. Okay? So in this case, I would argue that the X-ray, probably unnecessary, didn't give us any new information because there's nothing that doesn't actually mean anything. Okay, and to illustrate this, I've had degenerative disc disease since I was 25, and it's because I do heavy deadlifts. Okay, but am I in pain on a day-to-day basis? No, not at all. So completely incidental. There are cases of symptomatic degeneration. That's totally a thing before somebody completely misinterprets what I'm saying, but that's only in severe progressed cases or stenosis, whatever. So yeah, I'm doubtful it's that degeneration, which is a good thing, okay, because that tells us that it could be due to like a movement issue or a load tolerance issue, which are things that we can fix in here. The only thing that fixes degeneration is literal bone shaving, right? Like when we're working with cases of degeneration, it's about symptom management. But that's not what we're dealing with here. So that's what I would say about that. Your MD did great in that manner. Regarding and we'll do an analysis, we'll do an exam to figure out if we agree or disagree with the physio and then come up with a plan. Okay. Regarding the head and the neck and the headache complaints, Leah, you're pointing like right to the very top of your neck as an area of like primary tension for you, yes?
I think it used to be, and then lately it hasn't been as bad there.
Good.
I've more so noticed it like the sides
more down
here.
The sides even.
Not sure if that's from like sleeping position or what, but
couldn't tell you yet.
But when I do notice it up here, that's when I'll kind of notice
the headaches, right?
Yeah.
So the very top of our spine, base of the skull, is referred to as the suboccipital area, including the suboccipital muscles. Those guys are responsible for the bulk rotation ability of our head. Okay. And they're also one of the most common culprits for what we refer to as a cervicogenic type headache. Okay? Cervico meaning neck, genic meaning originating from, right? So cervicogenic type headache that comes from neck structures, essentially. There's your Latin lesson for the day. But with this tension being up here and resulting headache, again, incredibly common that, fortunately, chiropractors, and specifically the spinal manipulation aspect, are very, very good at addressing. Okay, so fortunately, you're not having a headache really right now, or are you? No, not right now. Okay, so that's good news. In the event, we're still going to treat your neck. We're still going to feel through. We're going to do whatever you're comfortable with. In the event that you get another flare-up of that headache, okay, and you're feeling the tension in there, I really encourage you to come back in and see me to see what would hopefully be a significant before and after effect.
Yeah.
Okay? Otherwise, I mean, everything you're saying kind of seems like it makes sense. We're going to get into the physical exam to confirm all that, and then we'll get into treatment, okay?
Yeah.
Do you have any other questions for me before we get started, or are we good to go?
I don't think so.
Perfect. Let's get into it. All right, Leah, so we're going to get started with neck range of motion exam, okay? So first things first, I'm going to get you to bring your chin down to your chest for me, okay? Now, does that provoke any kind of tightness sensation in the back of the neck here? Does it create the headache complaint at all? Or tell me what you feel.
Not headache, but I think right here.
You're definitely feeling some big pulling down through your neck. She's pointing to her levator scap area. We should be very familiar with that by now, but we'll throw a diagram up there of it anyways for you guys. If I go ahead and do something kind of mean and push your head further, better, worse, or the same?
Worse.
Worse. Okay, come back up for me. Why don't you look up towards the ceiling for me next, okay? How's that? Is that okay?
Little bit of tension, but not as bad.
Where?
As down.
Is it more at the
I think
higher?
Upper, yes.
Yeah, okay, so that's more up towards the base of the skull. Again, I'm going to bring you a little bit further back. Better, worse, or the same?
Worse.
Worse, as I'd probably expect.
Yeah.
Can you sort of rotate your head as far as you can to the right, please? We can get to 85, almost a full 90. That actually might be a full 90. Well done. And then rotate as far as you can to the left, please. Okay, so interesting. To the left side, we're able to get to about 60 degrees.
Oh.
Okay, right side, we got a full 90. Left side, we got 60. So that's a pretty noticeable asymmetry, which tells me that there's probably something going on up in the suboccipitals. That, combined with the patient report, definitely something that we're going to check out. I need you to tilt your right ear down to your right shoulder for me, please. We can get to 50 degrees. That's really good. We can go left ear, left shoulder. we get to, again, less than 50. So we see maybe we're at about 45. 40? We're not at 45, 40. So we see a decrease in the range of motion of both left rotation and left lateral flexion as compared to the right. So that's interesting to see. And get you to give yourself a big, tight hug, okay? You probably earned it. And then we're going to get you to rotate as far as you can to the left side. Good. So here we can get to about, I'd call that 70. Now rotate as far as you can to the right, please. Here we can get to even further, 80. So not much of a difference. There is a small one. Were you like a dancer or a gymnast or something? Because you actually seem like you have a lot of thoracic rotation compared to a lot of people. Really?
I did like swimming and baseball as a kid.
Okay. Impressive. So you've got a lot of mobility for just a normal person.
Yeah.
That's very impressive.
Okay.
Going to get you to stand up for me next, please. And then from this position here, I'm going to get you to just try to bend down, touch your toes for me. Does that provoke any of that lower back SI pain at all?
No.
No? Okay.
It's like a little tight, but it's not pain.
Now what about bending backward the other way? Does that provoke anything in there?
So like not right now, but previously I remember that motion hurting. So yeah.
The extension-based movement was aggravating. The forward flexion, right, because that's how you initially injured yourself too, right?
Yeah, and I do some yoga too, and that's when I notice it too, is anything that's that way.
Okay. All right, so Leah is currently experiencing symptoms on her right side, so I'm actually going to start with her left side. The reason being, I like to start with the side that is unaffected by anything in patients who are asymmetrical to try to get a sense of what their normal is. So I'm going to go ahead, take your leg, Leah, and I'm going to lift it kind of straight up. And this is where she really flexes the yoga classes that she takes, because she's able to get up to like 100 degrees, which is, well, at least 10 degrees more than normal. Now at this point, I want you to slowly lower the leg down yourself. Slowly lower, slowly lower. And during that, do you get any pain on the contralateral or the right side of the low back there?
Yeah, a little bit when it was down.
Kind of lowering it down, right? Okay. So when we are, first off, that's called a crossed SLR, when we're doing a straight leg raise on one side but get symptoms on the other side. When we are slowly lowering the leg down, we are doing two things. We are, first off, eccentrically loading the QL muscle. And what that is, eccentric loading, is resisting the lengthening of a muscle. It's also the hardest or most intense form of exercise that a person can do. And then also we're shearing the SI joint a little bit, but on this case we're getting the pain on this side. So is it a QL complaint? Is it an SI complaint? We don't know, but there's definitely something going on. Now let's go ahead and do that on the right side. I'm going to bring this all the way up. So we can still get to 100 degrees, really good hamstring mobility. Now I'm going to get you to slowly lower down as far as you can. Let me know if you start to get anything back there. Was that easier?
Was more when I was up high.
When you were up high.
But it wasn't pain, it was just like a little bit of uncomfortable.
It feels a little uncomfortable. So one more time, we're going to bring that back up. Now where are you feeling that as we're up here? Are you able to point to it?
Yeah, like underneath.
So lower down. Okay, so she's definitely pointing. You can lower this down now. Back to her SI joint. To confirm that or to check it in a different way, I'm going to bend your knee. What I'm going to do is I'm going to place my hand behind your hip on your SI joint there, okay? And I'm going to push through. Is that at all uncomfortable for you?
Yeah, a little
You're
bit.
making a face that would suggest to me that's quite uncomfortable. Now I'm going to bring this one up. Just compare it to this SI joint there, and how's that? That feels like nothing?
It's
Or
okay.
feels like nothing. Okay, so let's do a hip screening, even though I assume that you're going to be just fine based off the straight. Holy crap, she's at like 80, 90 degrees. That's okay. Open this up. That's okay. And then bring this up. That's about 80 degrees still. You are very mobile. I'm very impressed with this yoga routine. Good. Okay. So first things first, I'm going to get you to bring your arms up for me and just keep them there. Don't let me move them, okay? Fight, fight, fight. Good. Nice and strong. Fight, fight, fight. Good. Strong. Bring your arms forward and curl the wrists backward for me, please. Curl them back. Don't let me move. Strong. Grr. Nice. I like the ring. It's cute. Flowers. And strong. Good. Turn over. Curl the wrists inward, please. Good. Good. Fingers curled. Keep them strong. Turn over, fingers straight, and please gently squeeze my fingers. I always have to say gentle because one person nearly broke my hands one time, and that's not impressive. I need those. All right, we're going to do some reflexes. Good. Good. And just drop the arm. Good, good. Let me hold you. Give me the full weight of it. Full weight of it. Good. Good. And same on this side. Turn over. Relax right there. Good. And I'll come around back. Do this one from behind. And just drop the arm for me. Drop. Good. Good. Awesome. That will be a normal upper limb neuro. All right, I'm going to get you to push this leg up as hard as you can into me. Good. Push this leg up as hard as you can. Good. Lift this toe up as hard as you can. Awesome. And toe up as hard as you can. Good stuff. Okay, now just relax both legs for me as best you can. Nice. Oof, so big on that side.
Yeah.
There we go. Okay, so equal on both sides. That's what's important. Relax that leg for me. Good. Good. Foot kicks. Relax that foot. Good. Foot kicks. And then lastly, good old Babinski's response. Negative on both sides. I know those suck. Okay, you did great. That's a normal lower limb neuro. So once again, you're saying that your discomfort primarily on the right side here. Are you referring to, and to clarify, like I know where the SI joint, but I'm going to check with you, is right here typically where you feel most of your discomfort?
Yeah.
Yeah, okay. So that is very much the SI joint, okay, right where the sacrum, which is the bottom bone of our spine, connects into the, I'm going to show you guys on this side, connects into the hip bone over here, the ilium, the sacroiliac or SI joint. Do you get any kind of residual discomforts up more into the muscle, like in this region too?
Yeah.
Yeah, so right where my thumb is too, do you feel tender right now? Mm-hmm. Okay, definitely. So the QL itself connects down into not the SI joint proper, but the ilium, again, that hip bone. So any issue with the joint down here will also have issues with the muscle because it's connecting onto the bone that's involved in that joint. That's a great example of why we're holistic creatures. It's never just one thing. It's also going to be all the things around it. So we're going to go ahead and just climb up the lumbar spine now. And also feel the left side versus the right. As I press through, does that feel a little uncomfortable for you? Yeah, okay. Direct overpressure aggravates. And let's go up into the upper back too. So definitely as we get higher up here, I'm noticing quite a bit of tension.
Yeah.
Yeah, okay. Are you left or right-handed?
Right.
You're right-handed. I couldn't have guessed that because honestly, well, I mean, statistically I could have. But up here, like you feel, people are usually tighter on the side of hand dominance and you feel very tight on the left. Let's actually go ahead and check out the right side. Okay, so you are wincing. Are you ticklish or is it tender?
No, it's tender.
It's tender. Okay, so she's not ticklish. She's squirming because that hurts.
I am ticklish, but not there.
I'm not tickling her. I swear to God.
Yeah.
But it's just she's tender. Okay, and I'm not putting that much pressure through. I swear this is maybe a 4 on the pressure scale, but she's like wiggling around trying to escape. So yeah, she's definitely very, very locked up. And that's something that, you know, regular physiotherapy or chiropractic or massage can all help with. So today, obviously, we're going to combine those things. With that said, what I'm going to do is I'm actually going to work all your muscles and joints along the back just while I have you in this position for now, okay? And then we'll get into some actual adjusting. I'll tell you when. Mm-hmm. So first things first, I'm going to let's actually work this side first because this is the side that's being bothered. I'm going to hook under your hip there, and you should just relax onto that hand, okay? And from there, now if anything I'm doing is uncomfortable or provokes the pain too much, you let me know. But I'm just trying to take a bit of an osteopathic approach to start here for you. Sorry, not really. There we go. You okay?
Yeah.
Good. Okay, so what I'm going to do here is that, apparently. Didn't even mean to do that, but I'm glad we were all quiet for it. I'm going to just kind of trace my way with some pressure up and down that upper back specifically, then we'll get into the lower back, okay?
Mm-hmm.
Okay. I'm going to get you to take a big breath in for me, and all the way out. Sink into the table, breathe. Good. Is that okay?
Yeah.
You're good. If you at home want to play a fun game, every time I say, "Are you okay?" do a push-up. You're going to be absolutely jacked by the end of your way through this channel. Okay. I'm going to just turn your head. Nope, not there. That's okay. One more in. All the way out. Whew! That was a deep one.
Yeah.
That was a lot. You still breathing?
Yeah.
Perfect. Okay. Good, good. All right. Good job. We're going to do your lower back next. Leah, you're almost in the right position here. What I'm going to do is just kind of fix you up here. I'm going to take that, pull it, and you can hold right there. You're going to straighten this bottom leg for me. And we're going to bring that up. Perfect. And scooch it towards me. Thank you so much. So you're not going to fall, okay? I promise. You might feel like you're going to, okay? And that's because your head, it's up here. It can't see my tree trunk of a leg in the way, okay? But what I'm going to do is I'm going to roll you towards me. And again, you're just going to relax. I promise you're not going to fall. To illustrate this, see? You're not going anywhere, are you? Exactly. All right? So big breath in for me. And all the way out. All the way out. Good.
My reaction to anything is just laughing.
Honestly,
okay.
That's a better reaction than crying. Okay, so we like laughter on this channel. Laughter is more than welcome. We'll get you on the other side, okay? All right, we're gonna fix that because that looks a little uncomfortable on your wrist there. Gonna go ahead and you hold right there. Good. Gonna bring this leg right up and scooch the hips once again. Close to me, please. Thank you so much. Same concept, okay? Promise you won't fall. Mm-hmm. And don't even worry about the breathing this time around, okay? Nope, she's worrying about the breathing now. That's because I said it.
Yeah, now I'm thinking about it.
Yeah, well, don't. There we go. See? Totally fine. No need to stress that whatsoever. Good job, Leah. Great job. All right, so Leah, I'm just going to come in here and kind of pick up your head. Now, you just give me the full weight of your head. Don't you worry. I can manage it. So first things first, we had some left-sided reduction in movement. So we're going to start at the top left and kind of poke on through like that. Now, fortunately, I wish I could have all my patients set up like this because I can actually see their facial expressions quite well as I go through. But left side, how does left side feel to you? There's some as we get lower down. It wasn't too bad at the top.
Yeah, it's really bad right there.
Okay, so that's about a C4 area for you guys at home who are watching. About midway down the neck, a little bit just past half. So, and as we get down low, how does that feel there too?
Bad also.
Okay, so that's like the base. That's almost like first rib territory. I don't think I've done a first rib adjustment on this channel before, but we're going to be doing one today, it seems. Okay, so now let's check out the right side. Again, that's not so bad either, is it?
Like, it's still bad, maybe slightly less.
Less than it is usually, yeah? Ooh, there we go. Okay, that's a C1. There we go. You're tough and you're strong, okay? I feel now's the time to remind you of that.
Thank you.
No problem. So right side feels more mucky than left overall. That's just to my hands. The patient report might be different. Now you're also commenting that you have quite a bit of tightness on the lateral aspects, and I can feel that there. So do you feel tender as I press in through there? Okay. So on the sides of our necks, okay, like right in through here, we have our scalene musculature. Okay, they are muscles that connect off of our neck bones, or C-spine vertebrae, and connect down into our first and our second rib territory. That would also explain why we're feeling locked up on the left first rib. There would be due to very hypertonic scalenes. If they're really condensed up, well, what's that going to do? That's going to pull the first rib up. That's going to pull the neck down, create a feeling of tension. So it's all kind of checking out and making sense. I'm going to do a little bit of soft tissue work on the scalenes themselves. I'm just going to pick your head up here, take a thumb contact, and turn you like that. Now, if this is too uncomfortable, you let me know.
It's okay.
Okay, good. Trying hard not to get my shoulder in the way. Good. That's bad up there. Eh?
Yeah.
Oh. All right, Leah. Breathe, 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 breathe. I always have to remind patients to breathe.
Yeah.
They forget. It's such a weird thing to forget, but we all forget. So we're gonna go for the neck SMT, or the adjustment. Okay, so for that, you've had your neck adjusted before, right?
Yeah, years ago, but
years ago. How did that go for you?
It was fine.
It was fine? Everything was good?
Yeah.
Okay, yeah. I know you're a little bit nervous, but you're doing very well so far, okay? So what I need from you is I'm going to get you to turn your head. I need two things. Turn your head as far as you can to the right for me, okay? Far as you can. Good. And then I want you to just pretend that this hand is a pillow. Drop the head into it. Good. That's the first thing. The second thing that I need from you in order for this to go is to not know that I'm about to do it, right?
Yeah,
there you go. Good job. You okay?
Wasn't bad.
Good. Yeah, see? It wasn't bad at all. She's still with us. Okay. Now, down there, I'm going to try one more for that first rib that I mentioned. First ribs are quite notorious and difficult to get, but we're going to give it a try here. So what I'm going to do is just tilt your head like so. Oh yeah, it's tender even as I do that, isn't it? Okay.
Yeah.
Just relax the best you can. You okay?
Yeah.
One more try, okay? Oh, she's really tensing up now. We're going to take a second here. Good. That's not moving. We're going to have to do some more soft tissue before we revisit that. Okay, let's look to the right side. Relax for me. I can feel all that. Yeah, see? Did you even realize you were doing that?
No,
oh
I did
my
not.
Goodness. See, now she looks peaceful on the camera.
That spot is crazy.
Yeah, okay. Relax there. Oh, scaling, my bad. Got you, just relax, okay. Good. Now we're going to adjust that right side, so I need you to turn as far as you can to the left, please. Good. And just drop right there for me. Good stuff. Oop, don't want to hit the camera. Not bad. Just relax for me. Good. Awesome job. Ooh. Can I get you to slide down just a little bit for me there? Perfect. And yeah. Ooh, a little tender still? Mm-hmm. You're okay. What are you feeling?
Just like the back.
The back.
More,
like thereabouts?
a little bit up, I think.
A little higher.
Yeah, like around there.
Yeah, okay. Just up, and then what I want you to do for me is I want you to give me your best double chin. Okay, there we go, good, just like that. And then you just relax. Yeah, there we go. Nice, okay, relax. Relax, stop with the double chin. And one more time, double chin, go ahead. Good. This one's always fun. I haven't done this one on camera, but it brings me joy. So, and relax, and double chin.
Oh my god.
That's the spot right there, yeah. I feel like I could camp out on this for days. Yeah. Mm-hmm. Now that's probably a good feeling of pain that you're getting right there.
Like I always try to press on it
good.
to
Yeah.
massage it.
Are you able to press it as hard as I can right now, or no?
No,
Yeah.
that's the
Sometimes you just
problem.
need another force. Okay.
Mm-hmm.
Good. Okay. Let that breathe for a minute. Good job. Fantastic job. So Leah was quite sensitive throughout the lumbar paraspinals as well as the thoracic. So what we're going to do today is we're going to go ahead and do our usual instrument-assisted soft tissue therapy to free up any kind of fascial component that we may have. Yeah, the camera looks good. So the lotion's going to come on, might be a little bit cold to start. It's more of a gel, okay? But there you go to start, and there you go to start. Now, as I'm doing this, Leah, I usually like to ask the patient kind of a question about themselves, okay? And in this case, I'm going to ask about your work, what it is that you do, and why you find that to be rewarding. So do you care to share?
Yeah, so I do freelance marketing, so social media management, web design, stuff like that.
Okay.
So, yeah, I find it, I love working for myself.
Same. Same.
Obviously there's lots of perks of that, but I also like to help small businesses and see like results with them, and it's like it's nice to do something that they know is important but like they don't have the time for, and you're kind of just that designated like help person. So yeah, so I do that, and then I also work part-time as a lifeguard.
Okay.
So that's rewarding in its own way. We teach swimming lessons, which is always rewarding, especially when it's adult lessons. Because,
really?
You know, adults they really want to learn, and they're not there because
they're motivated.
Right?
Yeah, that makes a lot of sense.
So like that can be pretty rewarding. So yeah.
When I used to be a lifeguard too, right? Mm-hmm. And for whatever reason, I actually didn't like doing the adult lessons at all.
See, I don't really love it, but like I don't know. It is rewarding when it's a good
when it's a good bunch,
yeah.
Right? Yeah.
Yeah.
Mm-hmm.
It's hard though. It is harder because they have like certain habits, and it's hard to break them.
When you're a kid, if they're being whiny, you just dunk them under the water. There you go. Look at that. You're fine, Timmy. See, no need to stress.
Sure.
When you're an adult, you dunk an adult under the water, suddenly you're getting sued. So it doesn't really work as nicely. Yeah. Kids usually don't have lawyers. So yeah. That's a terrible joke. Everybody watching, please don't cancel me. Okay. As regards to the social media thing, I do have to say that meeting myself. Okay, you're tender there, aren't you?
Yeah.
Yeah, okay, relax into the table. I do have to say that meeting my social media manager was probably one of the best things that could have happened to me since graduating school.
Yeah.
So, like, what you're doing, make no mistake, you're helping business owners focus on their business, you know, the thing that they actually want to do, rather than the things that they, I'm going to use the word need here to do, such as their online marketing, right?
Yeah.
So please don't ever underestimate what it is that you're doing, and don't be afraid to randomly jack your price up 50%, okay? Because people will still pay it, apparently.
Yeah.
Yeah. Mm-hmm. So speaketh my own bank account. She's sitting in the corner right now. That's why I'm being super passive aggressive. Yeah. All right. A little bit more. You're okay. Just trying to like, sure, easy enough for you to say. Yeah, totally.
Yeah.
Breathe. They always forget to breathe. What did I tell you about breathing?
It's hard.
I know. Believe me, I know. Breathe. I need to hire a chiropractic assistant who just tells patients to breathe.
Oh my god.
Relax. You're good. When was the last time you had any kind of massage work? Never.
No,
Oh!
I did. I was going regularly to this one lady because my boyfriend got me a gift card.
Okay.
And it was like a significant...
Have you considered buying yourself a gift card?
I'm waiting.
Don't wait on boyfriend to do it, just do it.
I'm waiting. Maybe he'll do it at Christmas. But anyway.
What's his number? I'm gonna call him. I'm gonna tell him what to get you for
Hopefully
Christmas.
he watches this video.
Yeah, there you go. What's your boyfriend's name?
Joe.
Joe. We know what to get her for Christmas and her birthday and Valentine's Day and the anniversary.
And just like July and August, just whatever.
Just any day that ends in Y, great day to get her a massage coupon. Okay.
Anyway, so I was going quite a bit, but I'm trying to think when the last time I went. Maybe like end of 2023.
Okay, so we're talking like almost 7-8 months.
Oh
now.
yeah.
I can't do math, so.
I would say at least, yeah.
Okay, well, I'm going to advise that you get back there, okay? Because I'm not obviously going to stand here and do this for 60 minutes. I'll stand here and do this for 10. I know. That's a testimonial right there. Aww. Love it. But that's something that I feel would greatly benefit you, because I know that your primary complaint again is down here in this SI joint with the with the QL and the neck also kind of being present. Just realize the neck isn't in frame, but that's whatever. You're already too far in this. It's something that you should probably be doing because just feeling through, like you're tense everywhere. Okay, so that's going to be something that could help. Now that being said, I mean, what we're doing in here is still going to help you. I'm happy to help you out myself, but I think that 60 minutes of somebody else's elbow in your back could be quite therapeutic for you.
Yeah.
Not that this is my elbow, but you know what I mean.
Yeah, I remember when I first went, she was like, wow, I've never seen so much tension at your age. I was like, okay.
Thanks for calling me old. What could you possibly be stressed out about? Aren't you just going to go home, buy your third house? What?
Yeah.
The joke is that the Canadian real estate market is a joke, guys. That's the joke if you're watching from your American household. Not that it's much better down there either. You got a minute and a half left. Okay, you're doing great. Breathe. You have one job, and that's breathe. Okay. One more. And someone's going to be ready for a nap. Breathe. For MRT, what we're going to do is it's similar to ART, except I have you moving while I pin a muscle. Okay? So what I'm going to do is to start, you were really tight in those left scap areas, so I'm going to get you to look up and to the right. Okay? I'm going to take the people's elbow over here, and I'm going to go ahead and put it right there. Okay? And from there, I now want you to look down and to the left as far as you can, nice and slow. Okay, you feel that?
Yeah.
Just a lot, eh? Okay, and come back up to right. You can come right back. Slowly down to left. We're going to do that, let's say 10 times. Oh my God. 2. Down to left. You regret your words yet?
Pardon?
You regret your words and
Oh,
not
yes.
being over yet? Probably.
No, I like it though. It's like...
Good. It hurts so good,
yeah.
right? It hurts so good. Up to right. Do you remember those like high school aptitude tests that
Yeah.
they'd make you take to like show what field you'd be good in?
Yeah.
Yeah. Do you remember what you got on yours? Probably a while ago now, but
I think it was actually similar to what I do.
Oh,
it was
good.
like I want to say it was like journalism or like
Okay.
public relations or
It's
something.
pretty similar.
So it's kind of similar.
Mine always came back and said sadist. So chiropractor is as close as I'm gonna get.
Nice.
Yeah. Good. One more. I can't count. I think that was 10. Good. Awesome. All right, face forward. I'm going to get you to tilt the right ear to the right shoulder, please. And left to left. So,
Wait.
yeah. Okay, so we're going to go from, my bad, right ear to right shoulder.
Yes.
And I'm going to take the contact, and then you're going to go.
Oh.
No, you're going to go left ear to left shoulder like that.
Okay.
There we go. I'm going to actually just come neutral for a second. Let me get my elbow in there first. Okay, now come right. Good, and now left to left. Go ahead. Good, right to right. Left to left.
Oh my God.
This is probably the worst one for you, huh?
Yeah.
Left to left. Right to right. Left to left. Right to right. Left to left. One more. Left, right to right. Left to left. Oh my goodness. That right there. Okay, so I know you're saying you're getting a lot of tension in the side of your neck here.
Yeah.
Entirely possible it's actually your traps. Okay,
Yeah.
Your traps start here, they come all the way up and connect into here. So me just working that area, that probably felt like what you're feeling in the side of the neck, yes?
Yeah.
Okay, yeah, definitely not the track. Okay. Let's do the other side. Can you get you looking up and to the left, please? Good. And now slowly down to right, go ahead. Up to left, slowly down to right. Up to left, slowly down to right. Woo. Breathe. Up to left, slowly down to right. And up to left, slowly down to right. Good stuff. Face forward. Please tilt left ear to left shoulder. Slowly right to right. Go ahead. Left to left. Slowly right to right. Left to left. Slowly right to right. Left to left. Slowly right to right.
Oh my God.
There is no escape. And left to left. Slowly right to right. Oh my God. Okay, good. I get you to shrug your shoulders, both of them up for me. Slowly lower them down. Up, up, up. Up, 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 up. Slowly lower. You got one more. One more. Up, up, up. Slowly lower. Okay. Bet she regrets saying she wasn't done now. No problem. Good job, Leah. Leah, thanks for coming in. How did you find all of that? How do you feel right now?
I feel good.
I hope so.
I feel like the last thing, like,
The BMRT, right? The
Yeah.
elbow in your neck?
Yeah, like I'm feeling looser for sure.
Good.
And then,
How did you find the neck adjusting? You seemed pretty nervous about that at first.
yeah, it was actually fine.
It was okay.
It was quick.
A lot of people stress out about it, but really, like, it's a very common thing. People getting the neck adjusted, it's a very safe thing to do as well, provided you've been examined by somebody qualified to do so. Okay, in this case, totally fine to do. And then also we did the tools. You were squirming quite a bit with the tools.
Yeah,
there.
I think I was just so tense in the shoulder area. But like it did feel good. It was just
So I would highly recommend that that's something you incorporate into your normal self-care routine, not necessarily the tools, but some kind of massage work. Mm-hmm. You didn't have that much redness actually show up on your back, telling me that you don't have much of a fascial issue, but there's still a lot of tension, so massage therapy would definitely be a recommendation for this case, okay? Now, you said you were also seeing a physio. They've been doing a progressive rehab plan with you, implying that the exercises themselves have been changing and getting progressively more and more difficult, which is really, really good. Okay, I don't say this very often on this channel, but it seems like Leah's found a very good physiotherapist, and it's sad that I don't say that very often, but that just seems to be the case. They're hard to find. So what exercises are you currently doing for that SI joint?
Yeah. Like we've added in different ones and cut out certain ones, obviously, but current ones, there's the penguin.
The penguin? I actually don't know what that
Okay,
is.
so you put a band around your ankles or your feet, and you I don't know if you could, if this is okay, but you go like this.
Oh, okay, okay. So they're lateral banded hip abductions.
So
I don't call that penguin though. So that's a new, but still, no, that would work. That would absolutely work for the glutes. You do the penguin. What else are you doing?
We do jumping jack squats.
Jumping jack squats.
Yeah.
That sounds like my personal hell. What?
So like instead of a normal jump squat, you start in the squat position and jump to your feet in.
Got it.
Because something to do with like landing. I don't know. She explained it, but
fair. Okay.
So that's one. We were doing like fire hydrants, like donkey kick, that stuff. Kind of cut those out to replace some of the others. But what else? I was doing a side plank. Okay. I'm not sure. I guess for the back.
So so any other ones as well, or is that pretty much it summarized?
I'm trying to remember. There's a speed skater one. Okay.
So a lot of body weight and like sport oriented stuff is kind of what I'm hearing you put down, which is good. All right. My question with you is that like this SI joint pain is coming on most predominantly like if you're standing or walking for too long, right? What about during the sports themselves?
Yeah, so sometimes it's just super random because sometimes I could play, like I had a whole tournament weekend with baseball.
And you were totally fine.
And then a random game, like it hurt really bad and I was like, I don't know if I can finish the game. So, and same with volleyball, it's kind of sporadic.
One thing that I would consider incorporating into your routine is because the physio, I mean, those are all great exercises to do and I highly recommend them, but one thing that I've see that is kind of missing is like an actual heavy loading of the area, okay, or like an actual like a strength building exercise. And the reason I bring this up is because when you're doing any kind of prolonged walking or like any particular game, like you might be good with the plyometric, but what happens when you need to do a heavier movement for a while or a more endurance based movement over a longer period of time, right? So the only addition that I would actually make into this physiotherapist's routine is consider loading up the glutes in a heavier manner. And I say the glutes because those are the muscles that primarily provide stability to the SI joint. They cross from the sacrum over to the ilium and the greater trochanter area there. So do you know what a hip thrust is?
Yeah.
By chance? Do you go to are you a resistance trainer by chance? Do you go to the gym at all? Or
no.
A little bit?
I used to a little bit, so I know the.
Okay, you know the base. I would probably recommend to you to start loading up a heavy hip thrust. I can walk you through this off camera as well. And incorporating that strength component alongside the performance component. I think that will help round out the foundation of the treatment plan. But otherwise, that's a great plan, and it sounds like it's helped you out quite a bit, so I'd recommend you keep with that too.
Yeah.
Okay. Do you have any other questions about what we've done today, about what I'd recommend, or just anything in general that you want to ask?
I don't think so.
No? Okay, well if you do, you got the clinic's number now, so feel free to message me, okay? And otherwise, really, really thankful you come in today.
Yeah, thank
All right,
you.
so good to meet you.
Thank you.
We'll get into the gym stuff.
Don't forget to like, comment, share, and subscribe.
Thank you so much, Leah.